Hi, my name is Caitlin. I'm a student physical therapist from Alberta University. Today I'll be working with you. Is that all right?
Oh yeah, that sounds great.
Perfect. Thank you so much. Would you like some hand sanitizer?
Yeah, I'll grab some.
You grab some? All right, perfect. So, first let me start off by asking, what is your name?
I am Sean.
Nice to meet you, Sean. So looking at your PT referral, I saw that you're experiencing some dizziness.
Yeah.
Can you tell me a little bit more about this dizziness? Like, describe it without using the word dizzy.
That's kind of hard.
I know.
So, I guess I should just start and say I noticed it. I was going to like pick up my grandkid,
Okay.
and when I went to go pick them up, it was like the room was spinning. Like,
Okay.
I immediately had to sit down.
Okay. All right. Perfect. So you were bent over and the world just started spinning.
Oh yeah.
Okay.
Yeah.
All right. Perfect.
That was just pretty much. That was probably like 2 weeks ago. I noticed it. It's been happening. Probably happen another time.
So is that like your biggest complaint right now while you're here seeing me in my office? It's
for
the
sure.
The spinningness. Okay. Perfect.
I mean, I've had a few drinks in my day. I've been dizzy or like not feeling good, nausea.
Yeah.
But that was like
It's different.
spinning. Yeah.
Yeah.
That's the only way to put it.
Yeah. All right. Well, hopefully we can figure out what's going on, get to the bottom of this, because no one likes to be spinning. That's for sure.
No.
So, with physical therapy, what would you like your goals to be? Like, what would you like to get out of it?
Just be able to pick up my grandkids to stop the spinning.
Stop the spinning? Yeah.
It's just so unnatural. Like, I'm pretty active person. I like to think. So just get back to normal.
Okay. Are there any other activities that are causing that spinning that you're noticing? Like, or anything else when you're like bending over?
I have a garden.
Okay.
Sometimes that
triggers it when you're down like pulling the weeds and you stand up too quickly?
Yeah, I gotta sit back on my knees and kind of like
gather yourself.
Yeah.
Okay.
And it comes on really quickly. That's really it. I mean, it does go away, but it's like it's just there.
Okay, perfect. So I want to just ask a couple more questions just to rule out some other things that could possibly be going on. So do you have a history of vertigo? Ever had it before? So
No.
No? Okay. How about a blow to the head?
A long time ago, I had a concussion. But
concussion?
Yeah,
okay.
I was 15.
Okay, so a while ago.
Yeah,
okay.
yeah.
Have you ever been on IV antibiotics or life-saving medications?
No, like I said, I'm pretty healthy. I don't have any diabetes or anything like that.
Perfect. How about a history of migraines or headaches?
I get headaches once in a while, but they don't last very long. It's just normal. I drink a lot of coffee in a day.
That will do it. That will do it. So, sitting here, what would you rate your symptoms, that dizziness you're experiencing, that spinning of the room, whatever you want to call it? So 10 being absolutely like severe dizziness, 0 being no dizziness at all. So on a scale of 0 to 10.
Just sitting here?
Just sitting here. 0. Okay.
I don't have anything.
Perfect. That's good to know. All right. So when I was reviewing your chart, I saw that you're on Valium, which is actually a medication that depresses your systems, which is going to cause you to not experience that dizziness. So did you happen to take that today?
Yeah, I took it today.
Earlier this morning, though, like a while ago?
Yeah.
Okay.
Yeah,
all right.
Once daily.
So, okay. So we might want to talk to your physician just because with what we want to do, we want symptoms. So to be able to treat it, we want to experience the symptoms. We have to see the symptoms. Okay?
Okay.
Is that all right with you? So we can have a conversation at some point.
Hey, whatever you think is best, Doc.
All right. Perfect. So I'm going to start off by just getting your blood pressure because I saw that you had a history of hypertension.
Yeah.
Okay. So I'm going to start off by taking that real quick.
Left arm, right arm?
I'll do your left if you don't mind. Don't do that.
You want this off?
Oh, no, you're fine. You're good. Sorry, I'm going to warn you, my hands are ice.
That's fine.
They say cold hands, warm heart, though, right? Good. Relax. Really? Never?
Never.
I always have freezing hands. So much going on here. $110/70. That's amazing. Those medications must really be working.
Yeah. I mean, I take those every day too. The Valium I'm not so great with. I don't know why.
Well, that might be a good thing, because you're only supposed to take that if you're having symptoms, right?
Yeah, I don't really have, like, it doesn't happen that often. Like I said, it was like 2 weeks ago. I really haven't had it since. But it comes on right away. I mean, like, I know it. I know when it's happening.
Yeah, I bet. And is it like, as soon as it comes on, is it like it gradually increases and then decreases, or is it like continuous when you're having the symptoms?
No, it's there, and a minute or two, maybe max, like 2 minutes.
Okay.
And it's like, it's gone. It's like it never happened, but it is like almost petrifying. Like it's really debilitating, spinning.
Okay. All right. Well, hopefully we can get to the bottom of this. Okay.
Yeah.
So, based off of what you're saying, I'm thinking that you might be having vertigo, which is what. So vertigo is basically you have these crystals in your ear that are became dislodged, and now they're just like free floating. So they're moving in the fluid in your ears, your inner ears, and your ears are connected to your eyes and everything. So it's just like everything's all connected. And so as you're moving, well, as the crystals are moving, it's like you're thinking that you're actually moving. So that's why you're getting that world spinning sensation. Does that make sense?
Yeah.
So hopefully we can figure out where exactly these crystals are and get them back to the right location.
Yeah.
Sounds
good.
Sound good?
Yeah.
All right. So I'm going to do just a couple of tests here just to rule out, to make sure that we're able to perform these techniques. Is that okay with you?
Sure.
All right. So the first thing I want you to do is I want you to look down to your toes. Perfect. And now up to the sky. Any problem with either of those motions?
No.
Okay. Can you look over your left shoulder and then your right shoulder? That's your right, that's your left. There you go. Either or. And can you side bend ear to shoulder?
Yeah.
And the other side? Any problem with that?
No. I gotta be honest, anytime I look down and do anything now, like, I'm almost afraid. I don't know this.
blame you.
I don't know like when to expect it. That's the craziest thing.
I know, yeah. Well, hopefully we can get to the bottom of this and get you on your way to picking up your toy, picking up your grandchild, weeding, all those activities.
Yeah, my buddy Jimmy had the vertigo, and he said definitely go see a PT. It fixes it.
Yeah, oh yeah, you're
He
at the
said
right spot.
It comes back though?
There is a possibility that it could come back.
Is that kind of like what I've been feeling, or is that different?
No, so that's actually a little bit different. So like currently what you're feeling is what I was saying, the crystals. They're not in the right location. So we got to get them back to the right location.
Right.
But then down the road, there is a higher reoccurrence.
Right.
So it could come back.
Okay.
But we'll worry about that down the road.
Yeah, that must have been what he was saying.
Yeah. So what I want you to do next is I want you to lean onto your elbows. And now in this position, I want you to look straight up to the sky. And we're going to hold that for 10 seconds. Are you feeling any symptoms of dizziness, confusion?
No.
Good. I'm not seeing any nystagmus. So now what I want you to do is, keeping this head extended, can you look towards me? Good. Any of those symptoms I just listed, the confusion, dizziness, any of those?
No.
Perfect. We'll hold that for a couple more seconds. Get that 10 seconds in. Excellent. Now I want you to look to the other side. Any problems with that?
Nah.
Perfect. We'll hold that for a little bit longer. All right, excellent.
Kind of a weird test.
I know, I'm just making sure that you're not cutting off the blood supply with to the head.
Oh, sure.
So we can do these techniques. Is that all right?
Yeah.
I know it is a weird test. Okay, I'm gonna write down the table here for you.
Okay, we getting up there?
We will be, but give me 1 second. All right. So, what I'm gonna do. All right, Sean. So based on your complaint, I'm hypothesizing that it's going to be your anterior canal, but there's a chance that it could be your posterior, just due to that being the higher prevalence. I know that canals, you have 3 canals.
Yeah,
I know
one-
these are probably
one worse
over your
than the
head.
other.
Yeah. So we're just gonna find out where exactly those crystals are located, so we can get them to the right spot.
Okay.
All right.
Okay. Is
So-
there like any difference in prevalence? Like do I have a worse one or something?
We'll find out. We'll see if we can find out. Okay.
Okay.
So what I want you to do is we're gonna get up onto the table. So I got you a stool here.
Okay.
Okay. All right. Doing all right?
Yeah.
Okay, perfect. So, what I'm gonna have you do is we're gonna do what's called the Dix-Hallpike, which is a test to rule out the posterior canal. But as you're doing this, this also stimulates the anterior canal, but it's a different nystagmus I'm gonna see in the eyes, which is just like a beating. I'm gonna see a beat of the eyes. So it's either gonna be coming towards me or away from me, which will help to figure out where exactly the crystals are.
Sounds good.
Sound good? All right. So if you could you swing your legs up to onto the table here? Perfect. Yeah, scoot back. Oh, that might be a little too far. Perfect, I think. All right, Sean. So what I'm gonna do is I'm gonna have you first look to your. That's fine. We can look to the right first. And I'm
Okay.
gonna bring you back. So this is actually stimulating your right posterior, but your left anterior. Okay.
Whatever you say.
All right. So I'm gonna hold your head. Is that all right with you?
Yeah. It's fine.
Okay. We're gonna come back quickly. Okay.
Okay. You tell me when.
So on 3. 1, 2, 3. Good. Any symptoms? I'm not seeing anything really, except for a downward beating of the eyes. I'm not seeing that up beating. I'm seeing a down beating, but no torsional component. Good. Wait 10 seconds until the symptoms go away.
Should I be feeling something?
You'll feel a little. Are you feeling a little bit?
Yeah.
Because we're stimulating that anterior canal where I think it might be. So you're feeling a little?
Yeah.
All right, we're gonna bring it back up.
Okay.
Okay. So now this next one, we're gonna look over your left shoulder,
Okay.
which we're gonna bring it back, and this is testing your right posterior, but your right anterior. And so you're gonna most likely have a little bit of symptoms, but it's gonna be, what I'm gonna see is a down beating instead of an up beating, which is ruling out that it's your posterior canal.
Okay.
Okay? So on 3 again, we're gonna come back quickly, all right?
Sounds good.
1, 2, 3. Any symptoms?
Just not very comfortable. Not you, just this.
The position?
Yeah.
Yeah. So I'm seeing a down beating nystagmus with no torsional component. So that's ruling in that I'm believing it is an anterior canal. The nystagmus subsided.
Yeah.
Good. So we're gonna wait 10 seconds here. Alright, bring it back up. Good. Feeling okay?
Yeah.
Good.
I feel fine.
Good. So this next one we're gonna do It's just ruling in that we absolutely positively have the anterior canal.
Okay.
Okay? So what I'm gonna do is I'm gonna bring you back, straight back, and we're just gonna keep the head looking straight forward. I'm gonna bring you back, similar to what we were just doing, just not with the rotation. Does that sound all right?
Yeah, whatever you say.
Okay. All right. Feeling all right still?
Yeah.
So I'm
There you go.
thinking though this one is gonna cause symptoms, okay?
Okay.
All right. Take this right into treatment then. All right. So, you ready for this?
Is this gonna be? This is like, it's gonna be what I feel like when I lean forward.
Yeah, you're gonna feel that. But
Okay.
that's a good thing.
Is it gonna be there all the time, or
So it'll probably be there roughly about the 1 to 2 minutes that you've been experiencing it.
is what you're about to do pretty much gonna replicate?
Yes.
Oh,
yes.
okay.
We're moving those crystals. So
Okay.
I want you to let me know when you're feeling the symptoms, and then when they go away, and then we'll hang there. All right.
Yeah, sounds good.
We're gonna hold each position. Okay. All right. So let me start my timer here. All right, Sean. On the count of 3, we're gonna come straight back. Okay.
Yep. Whenever
1,
you're ready.
2, 3. I'm seeing a downward beating with no torsional component. Feeling symptoms, Sean?
Oh man.
Yeah? This is what brought you in? Yes?
Just hit me.
Oh, gosh.
It took a second. Oh wow. Oh yeah, that is horrible.
Is it getting any better?
No,
Not yet?
It's still there.
Still there?
Yeah, it's definitely still there. Wow. Wow. Alright.
Symptoms are gone?
Yeah, it's getting there. It's just you put me back and I was like, maybe she's lying. Then it came on strong. Yeah, it's starting to do that.
Perfect.
It's pretty intense.
Yeah? Sorry, I tried to warn you. But that's what we want. We want to have symptoms. Because that's the only way this is going to get better.
Yeah, it stopped.
Okay, perfect. All right, I'm going to bring you back up. Okay?
Okay.
Go ahead and sit back up. Woo. And now, you all right?
Yeah.
All right, so that confirms my hypothesis that we're working with the anterior canal.
Okay.
Because I was seeing everything was beaten down towards your toes
Okay.
within the eyes, but there was no torsional component, so I can't really tell which side is your affected side. So we're going to treat both. Fair enough? Does that work?
Hey, like I said, you're a doctor.
All right. So what I'm going to do, I'm going to do a supine 60-degree head hang. I know that's way over your head. So it's just the maneuver I'm doing. So I'm bringing you straight back with the head 60 degrees back, okay? And we're gonna hang tight there for 2 minutes. We're collecting all those crystals, and then we're gonna sit back up and dump them where they should be.
Sure.
Sound good?
Sure.
Any questions, concerns, worries?
I assume I'm gonna have that symptom again.
You will, I'm sorry.
Okay.
But hopefully, after today, we can send you on your way.
Yep. Sounds good.
Sound good?
Yep.
All right, Sean. All right, so on the count of 3, we're gonna come straight back, all right?
Yep.
1, 2, 3. Keep those eyes open. I would like to see that nystagmus. Excellent. Feeling all right? I know it's not ideal.
Oh boy.
Woo. We're gonna hang tight here for 2 minutes.
Oh man.
You all right?
Yeah. Oh my gosh.
Doing all right? Yep, we're gathering all those crystals.
About 5 seconds ago, that was
Terrible, right?
unbelievable. Wow. Yeah, they're gone.
Perfect. So we're gonna hang tight here. Gonna stay here for another minute.
Long time.
getting there. I know it's long.
Are these crystals in my head? Or
They're in your inner ear. That's a great question.
in my ear?
Yes.
Like in here?
Yeah. In there. Deep in there.
It's kind of crazy.
I know. The human body is amazing.
And that has to do with like what I've been feeling?
Yep. You got it. I know.
I thought it was the arthritis.
I know. Getting old for the birds, right?
Yeah, I mean sometimes I mean I had surgery a long time
So we're
ago.
gonna sit on back up.
And like when I came out of the
You all right?
yeah, when I came out of the surgery room, like, you know, obviously this is right after I had a knee replacement, but
Mhm.
like I had some like hypotension.
Mhm.
Even that, like, I always try to compare it to something to explain to people, and it's just there's no other word for it than it's spinning.
Yeah.
Crazy.
Yeah, it's a little rough. All right, so now ideally I would complete this 2 more times and hold the position for 2 minutes. But I'm gonna fast forward, so yes. All right, Sean. So now we completed it 2 more times. You feeling all right?
Yeah.
Excellent. So I'll have you swing your legs back over the side of the table here. So, now I believe we've gathered all the crystals, but there's a chance that we might have not gotten them all. So what I'm gonna do is I'm gonna schedule you for another visit tomorrow. But if you go home and you're doing your daily activities of like going down to bed to weed, pick up the toys, pick up your grandchild, and you're not having any symptoms, feel free to give me a call and we can cancel that appointment because that means we got them all in the right spot. But if we didn't, we'll try again. We should be successful getting the rest of that calcium, the crystals, back to the inner ear or into the right spot. There is, however, a chance that this might come back down the road. Yeah, I know your buddy had said something to you, right?
Yeah.
About it. So down the road, it might come back, and hopefully you come back to us, and we can get it all figured out.
Sounds good.
All right. So, any questions about today's treatment?
No,
No.
I pretty much get what you're doing.
Yeah?
It's kind of like one of those like ball things, right?
Yeah, exactly. Just moving it around, getting it to the right spot, getting it in the hole.
Sure.
Yep,
Yeah.
you're right. So, no questions about today's treatment?
No, I understand.
All right, so as long as the symptoms are, if they come back, what are you gonna do?
Call you.
And come in, right?
Yeah.
All right, but if you go home and you're able to complete everything, you're good to go, and we can cancel tomorrow's appointment.
Sounds good.
Sound good? Well, it was a pleasure working with you today, Sean.
Yeah, thank you. Thank you. Are you pretty much good to go then? Or?
Yeah, you're set.
All right.
But if you have any other problems down the road, like experiencing any off balance, dizziness, feel free to give us a call. We're here to help.
I will, especially if it works.
All right, perfect.
Thanks.
It's nice meeting you.
You too.